Welcome to the Fitness Plus Technology Podcast for club owners, operators, and fitness professionals. Each week, host Bryan O'Rourke brings you an expert interview with a global influencer at the crossroads of fitness and technology. You gain the insights, tools, and inspiration you need to stay connected to the pulse for what matters most for your business in the age of exponential technologies.
Hello, listeners, and thanks for joining us here on the Fitness Plus Technology Podcast. I'm your host, Bryan O'Rourke. I really appreciate you making time to listen in. It is already November. Been quite a long year. I mean, I'm sure, since March, it feels like 2 or 3 years at times. And there are some challenges going on out there with our colleagues in Europe in the fitness space, some shutdowns. But next year, some things are going to change. I remain optimistic, and I hope you do too. Just hang in there. Today, our guest is Brent Darden. Now, for those that don't know, Brent has a very long history in the health club and fitness space. He served as a personal trainer. He worked in wellness, corporate wellness, and then was general manager for Cooper, out of Dallas and their whole Cooper Fitness Center, et cetera. Went on to do a very notable award-winning turnaround for Telos Fitness in the Plano, Dallas area, which was a fantastic facility. He served as chairman of the board of IHRSA, of course, and then has been an advisor, consultant, and chairman. Most recently, the board of IHRSA appointed him, and he graciously accepted serving in the interim president CEO role of IHRSA, which I've worked with Brent personally. I've been able to travel with him, see him speak. He's just a phenomenal individual, and given everything that's going on with IHRSA and in his role, it was very kind of him to make a few minutes. Now, this interview is not going to be too long, so please hang in there, about 20 minutes, give or take. But we touch upon some great information, so I hope you enjoy it. And in the interim, if there's anything I can do to help you, please, Bryan K. O'Rourke on most platforms. I'm here to be of service. If I can do anything to be of help during these times, let me know. And without further ado, let's welcome Brent Darden to the podcast. Well, listeners, again, as I said in the intro, having Brent Darden with us is a real treat. And I know personally how occupied he is in his role right now, as I explained in the introduction. And I want to tell him, as well as the listeners right now, how much I know we and other board members at IHRSA and the industry appreciate his having stepped in. And Brent, it's only been, 10, 11 weeks maybe that you've been in the role? It seems like a year or two.
We just unbelievably just recently passed the 60-day mark. So I think I'm on, 70 days, about 8 hours and 6 minutes, something like that. Not that I'm counting.
Yeah, you got the countdown clock right behind you on the screen. I see that. That's great. Well, really, listen, I want to acknowledge you. You have such a wonderful reputation around the world. And I had a chance to be with you and your lovely wife and watch you speak in Japan a couple of years ago at Sport Tech, which was a real treat. I'll never forget that dinner with the traditional dinner with the sake, that was a lot of fun, huh?
It was, yeah. And I love their closing ceremony with the cheerleaders and the dancers on stage. That was quite the spectacle.
It was. That's a heck of a show of Sport Tech. I really enjoy that. At the recent GGFA event, and you went to see those fine folks, good friends of ours, both in Las Vegas. You presented, I had a number of people, by the way, tell me you went through some facts, and I know you do this routinely, given the pandemic and what is going on. I mean, you touched on things like, for example, what a low infection rate, all this data reflects that, the idea of our industry being essential and policymakers, many of them not understanding that. Can you share some of your insights on that and give us a little food for thought in that realm, Brent?
Yeah, there's been a ton of research done around this, actually, and it's a shame that the elected officials, at least here, well, not just here in the United States, but really around the world, are not really paying attention to the data and the science about the risk of contracting COVID in clubs, because it really is overwhelming. Europe Active commissioned a study with a couple of universities looking at 62 million visits across, I think, 170 different facilities around the world, and particularly in Europe. And the infection rate there was 0.078 per 100,000 cases. And then MXM, in conjunction with IHRSA, did a study in the United States tracking over 43 million visits and found an infection rate of 0.024. So those are a couple, really staggering statistics. Those are really, really low infection rates. And some might say, well, those are sort of, industry related research efforts. And that might be true, but the data is still the data. And then you look at a state like Colorado and Washington State and Louisiana, who are tracking where COVID has occurred here in the States and what the infection rates are. And they're actually listing out in a public forum, completely third party, where infections are occurring and where they're being traced back to. And in the Colorado clubs, which there's hundreds and hundreds of clubs, hundreds of thousands of visits over the last 4 months, and there's 0 cases traced back to health clubs. The same thing in Washington State. So, the shame is the fact that there is a lot of data that points to the fact that clubs really are not the issue, even though they're lumped in with bars and casinos and entertainment facilities too often.
Yeah, it's absolutely true. It is frustrating. And now our colleagues in Europe going through another realm of lockdowns. I was on the phone just this morning with colleagues and folks in Europe, and that's just, that could be another 6 weeks of additional, either stifling of operations or completely closing operations. That's frustrating as hell.
Oh, it is. Yeah, my heart really goes out to, so many club operators. Bryan, I know you have and still have business interest in clubs. And of course, I own my own club for many, many years. And people are just hurting, right? It's hard to keep your business alive for, 3, 4, 5 months of shutdowns, much less repeated shutdowns. And here in the US, our clubs in California, wow, they're talking about not being allowed to reopen till January or March of next year. I mean, that's almost a full 12 months of shutdown, and that's just hard to overcome. So, the latest projections are through some of our research at IHRSA. We already know about 10% of the health clubs in the United States have already closed. And we're expecting by year's end another 10% probably to announce such a thing. And of course, some of the bigger players are going through reorganization, if you will. And so it's just a really tough time for our industry.
It is. But, as difficult as it is, we know that sometime next year, knock on wood, this is going to be behind us more than likely. No one has a crystal ball as to when, but we know the stats people follow on the vaccines, the other things that are underway to correct this. And in the past, we've gone through these things and inevitably we get through them. But in the interim, we've seen consolidation. What's interesting to me is Europe has seen more consolidation than other parts of the world at this point. And then notably, with the GGFA event you attended with the RSG group, and they're acquiring golds, this kind of cross-border, consolidation, competition, whatever you want to label it. But have you been surprised at this point in time there hasn't been more significant M&A activity yet in the U.S., or do you think we just have to wait it out and see what happens?
I don't know that I would say the word surprised about it, but I do think absolutely it's a trend. It's been happening already, the consolidation, the mergers and acquisitions, the influx of private equity into our industry. And that's 100% going to continue. There's movements going on right now where some of the bigger players are, acquiring some of those that are struggling because the bigger players have the deeper pockets and they're able to survive and they're planning for the long term. And some of the smaller players just don't have the financial resources to make it through, what they're incurring through the pandemic. Yep. So I think that's accelerating the consolidation. And then I think private equity, in spite of the pandemic, still has a favorable outlook on health and fitness and that whole sector. And so, as you pointed out, this is going to pass. This too shall pass. And I think those people at the private equity level look much longer term, perhaps, than some of us that are in the day-to-day business of running health clubs. And so they know it's going to come back, and it's going to come back in a big way. And so I do agree with you 100% that there's going to be more acquisitions, more mergers, and more consolidation.
Yeah, I agree with you. And, and the good news is you're pointing to is just those underlying trends, be it the trends of chronic disease and primary prevention being, more and more valuable as an answer to those challenges from a societal and business perspective, and demographic trends, other trends that really still are underpinning a long-term super growth experience. And then on top of that, I'm interested to hear your view on this, is how technology has emerged. It was already kind of underway, the impact of technology on our industry space, but the recent course of events has certainly accelerated the adoption of tech. What are you hearing out there? People are doing a lot of innovative things, but when you're talking to operators, is there anything that you could kind of just as a general rule observe? I know a lot of people are really diving into how can tech help them, right?
Right. Yeah, of course. And of course, what the club operators are mostly consumed with is, I guess, two things: sort of using their data and looking at analytics and buying personas, which you are very familiar with, and really customizing their outreach mechanisms around engagement with members in a very specific way that's tailored to the consumer, to the member, to keep them engaged and keep them involved in the activities and programs and services that the clubs are offering. So that's number one. And then number two, the whole virtual digital offering. Most clubs, I would say right now, are into that space for sure. And before the pandemic, this is one of the silver linings of the pandemic, I think. Before, a lot of the club operators were sort of dipping their toe in the water, but they weren't sure how far they wanted to go. And now the pandemic's forced them really to jump in feet first, figure it out as you go, because they want to have those virtual offerings to their members, both online for classes, for fitness programming, for all those connective points that we know are so valuable and important. So I think they've all jumped into it. Looking long term, as I've had these conversations, and as you know, with some of the REX Roundtables I talked to, Bryan, just last week, this was part of the topic of discussion. And so I got feedback from probably 90 club operators just within the last 5 days about this very subject. And most of them they're in it. They're wondering if it's going to be a big part of their operation or it's going to be an ancillary part of their operation going forward. And where they're landing is, number one, it's a absolutely critical part that they need to have it. They still feel like their main value resides within their four walls, the in-person experience. But at the same time, they need to make sure they have this hybrid offering so that people can participate virtually as well as in person.
Yep. No, that's the sentiment that I hear so much. And I think that's, actually in the end going to be a very good thing. As you said, a bit of a silver lining if we can imagine one. A few more questions. I know how busy you are. And again, thanks for making time. Tell us, what IHRSA has been up to, internationally. I know it's a laundry list, and I love your Wednesday updates. Everybody will have the links in the show notes so that we can follow Brent as he does his video updates on Wednesdays, which are fantastic. But given some of these things we've touched upon, can you highlight just a few of the key initiatives, both domestically and internationally, that you've been working on around this whole situation?
Well, I'll start domestically with, one of the big things that's transpiring is we're renaming and repositioning the Industry Leadership Council. Most people refer to it as the ILC, and it's now called the National Health and Fitness Alliance. And the great news about this sort of repositioning is that it's going to be much more inclusive, Bryan. So we're going to allow suppliers, vendors, manufacturers, studios, aquatic facilities. It's been very sort of closed group, if you will, and hasn't had broad participation. And to affect the things we want to affect from an advocacy standpoint here domestically, we need a broader voice and we need a louder voice, which means we need more people and we need more funding. And so the way this is going to be changed is going to allow us to accomplish both of those things. So we're real excited about that. We already touched on some of the research. That's one of the strategic anchors for IHRSA. And so we're doubling down on that. And as an outtake of that, we're developing a medical science and health advisory board to help sort of lead us in those research efforts, not only around, the pandemic, right, and the likelihood of contracting COVID in clubs, which is very, very slight, but also longer term. We all know that health and fitness, has a lot of benefits. And so I'm preaching to the choir probably with your audience. But, one of the sad things about the pandemic, Bryan, as we both know, is that it's really exacerbated the pre-existing problems, right? Obesity, which was already an epidemic, is even worse. People are gaining the COVID 15 pounds or 20 pounds or whatever it is. Mental health is just deteriorating significantly because of isolation and the social unrest and layoffs and the economy and being, without their gym availability. All those things are coming together, and it's really taking people the wrong direction in their health, which they were already on that path. So we really have to turn the tide related to that, I think.
Yeah, that's great. A great recap. And I know you have a number of really wonderful people we do on the board and in the staff, and then even outsiders you brought in on these headlight teams to get our hands around these initiatives. And again, kudos to you and the teams that are working on these initiatives, because they're going to make a big difference. In closing, two things. First, what, if any, advice can you give for operators and professionals today in the market, given these dynamics? If there are any pearls of wisdom? And then secondly, that's a big question. I know I didn't even offer you that up front, but
that is a big question.
And so, I know you're a philosophical person, so maybe you'll have some quotes or thoughts to share. And then secondly, or finally, how can people get involved in helping you in the IHRSA organization? And again, we'll have some links in the show notes, but I'd really love to hear that out of the from the horse's mouth, if you don't mind me saying that.
Yeah. Well, as far as, advice, you and I were talking, before we started the show, Bryan, that this too shall pass. And my heart goes out, to the clubs and the people that are suffering, not just the clubs, but all the suppliers and manufacturers. Their revenues are down. And so we've really been at a low point in this year of 2020 in a lot of ways. But this is going to be in our rearview mirror at some point, I believe, next year. And I do believe that we're going to come out of this together. And when we do, there'll be less of us in this space. And while that's sad, it also offers opportunity to those that are able to survive. And I think we'll have learned some lessons, by going through this, as you always do. I continue to say, crisis breeds progress. It breeds creativity, inventiveness, and it propels action. And so I think that's a truism, I'd say, for everyone, that when you look up a year and a half from now, your business will be stronger because you'll be leaner. You'll be more laser focused on things that really are providing return on your investment. You'll have solidified your sort of strategic approach and your market differentiation and how you're positioning yourself with your consumers. Those members that you've been able to draw back will be closer to you than ever before, and they'll value your services because they now know what it looks like not to have you around. So I think those are some of the silver linings that I look forward to, in the future. And I do want to just thank everyone for listening to the call today or the podcast, because we're doing meaningful work together. The IHRSA board, and you in particular, Bryan, have really stepped up, during these times. And that's where you find out what people are made of too, when you go through these, times of crisis, people that come to the forefront and are willing to step up and take on that challenge. And we need to do it, right? Society needs us across the entire world. I talked about some of the things we were doing domestically and, of course, internationally. IHRSA, the first word in that is international. We're definitely an international trade association. We're working with partners around the world to, strengthen those relationships and making sure we're supporting their efforts, really, because every geographic region has a little bit of a different need. There's a lot of similarities around, research that's helpful. But here in the States, we can't even get the counties to agree on what the right directions are for opening or what the restrictions are, much less the states. And then you go to the world stage and it's, it's different from country to country. But IHRSA's trying to do our very best to give them the resources and the help and just extend a hand to help pull them up out of what they've gone through with the pandemic so that we can all enjoy a brighter future together.
Yeah. And Brent, again, I know you're you have a lot of things on your plate right now. I know the audience, and you've done a number of these things. You've been very gracious with your time. I want to again thank you for your dedication to the industry as a whole. You're a friend, and you're doing great work. And I know many people will continue to support the organization and you in your efforts. And brighter days are hopefully soon ahead. Thanks for making time, my friend.
Yep. Thank you, Bryan. Thanks for having me.
Hello, listeners. This is Bryan O'Rourke, and thanks so much for listening to the Fitness Plus Technology Podcast. The podcast is made possible by the Fitness Industry Technology Council, a consortium of global brands working together to enhance the adoption of technologies in the fitness space. Our company, Videri Ventures, which is invested in Vertimax, Montezuma, Gold's Gym, Houston, Texas, and Fitness 24/7 Thailand, also underwrites the podcast, along with our service companies, Integris Advisors, Moon Mission Media, and others. Please feel free to share this podcast with your colleagues. And if I can be of any assistance to you, don't hesitate to reach out, bryanko'rourke@gmail.com, or find me on any of the major social networks. Have a great day, and thanks for listening.